Hi, I'm Tom Lynch. Two things. Today I'm delighted to be joined by Paul Simmons. Paul is an Associate Chief Medical Officer of the hospital. Assistant Chief Medical
I
Officer.
appreciate the raise.
And intimately involved in our case management program. I guess the first question for you, Paul, is what is CDI?
CDI stands for Clinical Documentation Improvement. Those who've been around a while probably remember DRG assurance. But basically, you know the old joke, right? Every doctor says my patients are sicker. At the MGH, it might actually be true. And the CDI nurse reviewers, they're a team of specialized nurses who scour the charts and make sure we document everything that's actually going on. I hate to say it, I hope it's not news. We don't always document every complexity of our patient. Not talking about complications, just the complexity, the severity of illness.
So, Paul, one of the my inbox is filled with emails from docs who feel overwhelmed with administrative burden and find that the number of things we're asking of them is just extraordinary. How does this fit in with our efforts to reduce administrative burden for our practicing doctors?
Well, we can't drop it to zero, but I can tell you that we as a team, and the nurse reviewers in particular, this is what we talk about all the time. You say two things, I say 2 clicks. That's what we're aiming for in terms of how easy we can make this for people. And I say, look, if you can do something with 2 clicks in 30 seconds that makes $24,000 for the hospital, improves the severity of illness, risk of mortality, all the quality metrics, and the estimated length of stay, if you can do something else that does that, have at it.
And Paul, do you think Epic will make this easier or better?
It's probably about the same. It's a slightly different process, but in the end, it's right in there. It appears actually these queries when the nurse reviewers, and by the way, I should mention, they send it first to the responding clinician. So if an attending physician who isn't a hospitalist is getting one of these, that means your resident or fellow isn't doing it. So you might just tell them to do it. But it appears in 2 places, in the in-basket and in the incomplete charts. I think it's a reasonably smooth system.
Paul, thanks for your leadership in this effort, and thank you for all the work you're doing to help make our inpatient service work even better. I'm Tom Lynch, and that's Two Things.